My name is Arden Tomison. I'm the CEO and founder of Thalamos, which for the last 2 years has been working towards a digital mental health act. My introduction to acute mental health care came from my dad, who's a forensic psychiatrist in Bristol. But what really got me interested in mental health care, particularly the Mental Health Act, was when in 2016, my best friend's dad was sectioned. He'd had no history of mental illness and his decline was fairly rapid, meaning that my friend and the family were left grappling to understand the Mental Health Act and all the paper forms that went with it. What I couldn't understand at the time was why we as a society were managing an emergency care pathway by moving around bits of paper. And this set me off researching whether it would be possible to use technology to make access to care swifter and simpler for those who needed it. What we quickly discovered was that it wasn't just a case of digitizing paper forms, but rather the way in which multi-agency, multidisciplinary teams communicate, often in highly stressful and distressing environments. Layered on top of this were the technology challenges of getting lots of different legacy technology systems to talk to each other whilst maintaining the highest levels of clinical safety and information governance. So that was the challenge we were addressing long before anyone had heard of coronavirus. But what coronavirus has done is acted as a massive accelerant to digital healthcare tools in general. Now, in theory, this has been good for us, but as a values-led organisation, we really don't believe in digitising for the sake of it. If we're going to do it, it has to be swifter, simpler and safer than the status quo. And for me, the aspiration of technology should be that it enables the process to become more human and not less, and that the technology is the enabler that allows those in crisis to access care with the same urgency as a physical care pathway. I also believe it can start to demystify the process for families, carers and patients themselves, and that's what brings me to this debate today.